to my channel, Life with Everyday Haley. I feel like it's been a while since I've updated you. I really just have been focusing on my pregnancy and dealing with all the things associated with getting ready for baby. And I feel like I hit you guys with a lot of videos all at once, so I kind of took a little bit of a step back and just regrouped, but I'm going to be coming to you with some more content about pregnancy in the next few months as I get ready for delivery. So if you're new, welcome to my channel. I am a mom-to-be, a lost mom, a mom that has had 2 losses and is now pregnant with her rainbow baby. And I am 27 and a half weeks pregnant. So we are thrilled. We are in the nursery and I am just getting it ready all the time and just trying to prepare for the baby's arrival. And so that's what our life has been like. So welcome to my channel. All right, so this video is about second trimester symptoms and what the second trimester has been like for me. So I wanted to share that one positive thing about the second trimester has been the fatigue that I felt in the first trimester so severely is gone. I have energy to basically do what I need to do most days. In the first trimester, I just couldn't get anything done because I was just sleeping constantly. I have noticed that I do sleep in a lot more in the second trimester. If I don't set an alarm, my body could sleep till like 10 a.m. or longer. And I often let it do that when I can because I feel like my body needs that sleep. And my body's telling me that, hey, you're doing a lot, you're making a child, you need that sleep. But you feel a lot of fatigue in your first try because your body's literally like making organs. So that's a great accomplishment of the second trimester that most women identify with is, hey, I got my energy back. I can actually prepare for the baby. So most people advise you do most of your planning and preparation in the second trimester for your baby. Work on the nursery when you feel like it before 30 weeks. That's what I keep getting told. And so that's what I'm trying to do. I don't know if we'll have it ready by 30 weeks, but we may be close. Let's see. So I'm one of those ladies that had severe nausea even into the second trimester, and it didn't go away. Actually, it kind of got worse. And so I contacted my doctor around 20 weeks and I was like, I can't do this anymore. I'm really struggling. What can we do? And they said, let's try Zofran. So I said, please. So I've been taking Zofran every day. I usually have to take only 1 a day, and I will probably continue that the rest of my pregnancy. That has helped me tremendously and has allowed me to like have a functioning normal life. I was so nauseous that I just couldn't even do normal things. I was so sick. And so I'm really thankful for that medication. So always reach out if you're just really struggling past the typical first trimester. Another big one that's been a struggle is heartburn. I do take some over-the-counter heartburn medication that is appropriate for pregnancy. That's okay. And if I take that every day, I'm pretty much okay. I do sleep with 2 pillows at night just to keep my head elevated. If I don't, I feel like I wake up with heartburn. So heartburn is a really big one in the second trimester. Headaches can come and go. Usually I'll just take a Tylenol, which is okay in pregnancy. And I haven't had to take that much, so I haven't had a ton of headaches, but I know some people do. Gas. I've had a lot of stomach gas and constipation. Everything in there just kind of gets like shuffled together, and I've had moments of like a lot of gas pain or moments when I feel like I need to use the restroom but can't. And so some women take a stool softener. I haven't done that just yet. And also I do take Gas X sometimes. I'll take some gas medicine to just kind of calm my stomach down. That is okay in pregnancy also, just when you need it, you know, don't overuse things, which I don't. And Zofran also, the nausea medicine, is known to cause constipation, so it could be that that's factoring in for me. But constipation has been one of those things where I'm like, so I try to go to the bathroom anytime that I feel the urge and just keep things flowing, if you know what I mean. Let's see what else. Oh, pelvic pain. So as baby gets bigger, you will start showing more. My baby's been head down, and so I feel a lot of pelvic pressure and pain. That just gets worse into your third trimester. Some women have back pain. I haven't had back pain yet. I have had round ligament pain. I have had some Braxton Hicks, which is premature contractions preparing your body for labor. I have had some, round ligament pain and just cramping and just like growing. It's all growing down there, and most of the time everything's fine. If you were to start bleeding or having like actual timed contractions, I would definitely seek emergency medical care. But none of that has happened for me. So yeah, the pelvic pain, I invested in a belly band to give my belly support when I'm walking or doing long distance things or needing to be able to function or exercise. That's helped a lot with just some support, holding up that belly and that weight. Let's see what else. Yeah, sometimes that pressure is so intense, or that those gas pains that you feel like you can't walk. That's hard. That's only happened to me a few times, but it's very hard. Rolling over in bed is like extremely difficult, and I struggle every single time I roll over. I'm like in pain. And getting up and out of bed is hard. Bending over, I barely do it. If I get on the floor like I am now, it'll take me a while to get up. So you just kind of have to like, my doctor describes it as pregnant women are like turtles. They have like a shell. They have to try to navigate and move around that, and it's difficult. So your body starts changing a lot, and you can start gaining weight. You can start not fitting in your clothing anymore. You can start having to wear maternity clothes. I started having to wear nursing bras because my bras were feeling uncomfortable. My breasts were getting larger. They were changing colors, getting ready for breastfeeding. There's just a lot of changes going on. And so I switched to nursing bras already, which has me prepared and adjusted. And I think that was one of the best things that I did, was just allow myself not to have any pain when I don't need to. Some women's transition to maternity underwear. So there's just all kinds of things that you can do to prepare yourself as your body changes. And yeah, I think that's really like honestly the only things that I have identified with in the second trimester, other than acne. I've gotten a lot of back acne and very large, like painful acne. And I've been told that that's due to hormonal changes in pregnancy. So there's just a lot going on, and you need to be gracious to your body, be gracious to yourself, and just try as much as you can to get as much done now as you can for the baby in the nursery, because you really might not feel well in your third trimester, or something may happen and the baby comes early. So there's just so many possibilities. All right, so that's the second trimester. Have I enjoyed it? Yes. I think this one has been easier than the first, but maybe not that much easier for me. Honestly, I feel like it's also been difficult. And we'll see how the third goes. But again, I'm just so thankful to be pregnant and to be here. I'm going to be doing some more videos for you about like packing my hospital bag and what I ordered on my baby registry and how we are doing the nursery and postpartum products for mom and all things like that. So I'll come to you with that information shortly. Thank you so much for tuning into my channel, Life with Everyday Haley, where we talk about life and the things that I'm going through, and happens to be pregnancy now. So I hope that you found this video helpful. If you're having any of these side effects of pregnancy, I hope that you can find relief, and I know how hard it is, so just hang in there and the reward will be worth it. Thank you so much for watching, and I'll see y'all again soon.